Good afternoon friends. Today we will discuss about the blood pressure from B.SC. third year class, paper number 2nd, mammalian physiology and endocrinology. Blood pressure. The blood pressure is defined as definition of blood pressure. First definition, the hydrostatic pressure exerted by blood on the wall of blood vessel is called as a blood pressure. Second definition of blood pressure, this blood pressure is the force exerted by the blood against the wall of the blood vessel. The blood pressure is measured in terms of systolic and diastolic pressure. Blood pressure is measured in two terms. First term is systolic blood pressure and second term is diastolic blood pressure. What is mean by systolic blood pressure? This systolic blood pressure is defined as force exerted by arterial walls during systole. It is maximum pressure during the ventricular contraction. Diastolic blood pressure. This diastolic blood pressure is defined as the force exerted by blood against arterial walls during diastole. It is maximum pressure when the ventricles are relaxed. In the pulse pressure, third type is pulse pressure. The difference between systolic and diastolic pressure, difference between systolic and diastolic pressure, it is called as pulse pressure, and this pulse pressure unit of measuring blood pressure is millimeter of mercury, that is denoted by mmHg. Millimeter of mercury, that is mmHg. Normal blood pressure, systolic blood pressure is 120 mmHg and normal diastolic blood pressure is 80 mmHg. And pulse pressure, difference between systolic and diastolic pressure, systolic and diastolic pressure, that is 40 mmHg, that is 40 mmHg. The pulse pressure is difference between systolic and diastolic pressure, and normally this pulse pressure is 40 mmHg. Blood volume, when blood volume increases, pressure exerted against arterial wall also increases. If blood volume decreases during hemorrhagic or bleeding condition, blood volume decreases automatically, blood pressure also decreases. Blood pressure basically depends upon the cardiac output and peripheral vascular resistance. Blood pressure depends upon the cardiac output and peripheral vascular resistance. Peripheral vascular resistance. Here cardiac output is stroke volume. Here cardiac output is stroke volume into heart rate. Totally blood pressure depends upon cardiac output and peripheral vascular resistance. Factors affecting on blood pressure. There are different factors affect on the blood pressure. Factors affecting on blood pressure. First factor is age. Here this blood pressure varies throughout the age. As age increases, blood pressure also increases. At birth, blood pressure is normally 70 mm to 90 mmHg. In normal adult, 120 to 80 mmHg, and during the older age, in older people, systolic blood pressure rises with decreasing blood vessel elasticity. Next point is body size. It is also called as obesity. Body size obesity. It is observed that as the body size increases, blood pressure also fluctuates. Heavier and taller child have higher blood pressure than the smaller child of the same age. Next factor is diet. This diet also affects on the blood pressure. People taking diet rich in salt and cocaine intake also increases blood pressure. Smoking, in smoking, nicotinic acid also affect on the blood pressure. Nicotine, due to nicotine, blood pressure increases. Exercise, during exercise decrease the blood pressure, and exercise helps to keep blood pressure in normal condition. Diurnal variations. Diurnal variations. Usually person have low BP in the early morning, and this BP increases and peak in the evening. Medications. Next factor affecting on blood pressure. Medications. These anti-hypersensitive drugs have greater effect on the blood pressure. Chemicals. Epinephrine, antidiuretic hormone, causes vasoconstriction, thus elevating BP. Histamine causes vasodilation, and this decreases BP. Types of blood pressure. High blood pressure, and second type is low blood pressure. High blood pressure and low blood pressure. It is also high blood pressure. It is also called as hypertension. And low BP, it is also called as hypotension. In high BP, condition in which the force of the blood against the artery wall is too high. Usually hypertension is defined as blood pressure above 140 to 90 mmHg. Above 140 to 190 mmHg. Hypertension is a risk factor for many diseases including heart disease and kidney failure. Low, second type is low blood pressure. It is also called as hypotension. Occur in this condition when blood pressure drops below the normal range, that is 90 to 60 mmHg. Blood pressure drops below the 90 to 60 mmHg, and this low blood pressure also affect on make the person feel tired or dizzy. Measurement of blood pressure. Measurement of blood pressure. Measurement of blood pressure, there is two types. First type is direct measurement of BP, and second indirect measurement of BP. In this direct measurement, in this method a surgical artery is exposed and the pressure is measured using the mercury manometer. And indirect method, the pressure is measured without any surgical procedure. In this method, the pressure of brachial artery is measured using an instrument. It is called as sphygmomanometer. Using an instrument, it is called as sphygmomanometer and is a clinical instrument used for the measurement of the blood pressure. This is all about the histology of blood pressure. Thank you.